before we hear from Dr. Derek, to actually hear from a parent or a caregiver. So I'd like to invite Tara Curtin to come up and have a chat. Here we go.
Thanks. Hi everyone. Thank you for Brett and Dr. Derek for inviting me to come and speak about a parent's perspective of having a child with Noonan Syndrome. So when Sienna was born, this is my beautiful little angel, Sienna. When she was born, I hadn't heard of Noonan Syndrome, so it was a big shock to the system to find out I had a child with not only just a condition, but something that I'd never even heard of and knew nothing about. So when I was pregnant, there was a lot of complications during the pregnancy. I had polyhydramnios, hyperemesis gravidarum, which for those of you who don't know, it's severe morning sickness, just all day, can't control it. Cholestasis, I had that very bad extreme levels, which ended up causing me to be induced early. Severe edema. There was a thickened nuchal fold, which raised some alarms, and they were wanting to do some tests. Those tests came back fine. We did an amniocentesis. During the amnio, they drained about 1.5 litres of fluid off me because I had so much fluid. And from 30 weeks, I had to have daily ultrasounds because it was such a high-risk pregnancy in the end. And I was induced at 35 weeks. So during the birth and the newborn stage, Sienna was spent 1 week in the NICU and 1 week in the high dependency unit. She wasn't breathing properly, so she was on a CPAP machine for 3 days. She had a heart murmur, thickened pulmonary valve. She was born with small irises, so she had to have an MRI at 7 days old to check the optic nerve was functioning well, and it was. She got diagnosed with a duplex urinary system, so she has 2 tubes that go from the kidney to the bladder. She had extreme swelling in her lower limbs, which they thought was lymphedema. And she was missing a palmar crease, which is a red flag for a chromosomal disorder. So you can see in the bottom picture there. So if you have a look at your own hand, you've got the 3 palm lines. So Sienna's only got the 2. So one that goes straight across the top. So that's one of the first signs that they found that triggered that she has some kind of a disorder. These are just some photos of Sienna, and you can see in the bottom right she had the severe swelling in her legs, which the doctors, you can see it in all those photos, that the doctors thought she had lymphedema. And in the bottom corner here you can see she's wearing compression tights. She had to wear those for 2 years. And those are the tights. They had to be custom made for her every time she grew. We had to get another pair. So she had to be part of the plastic surgery team to be able to get those made up for her. She didn't like wearing them. Okay, going on to her development. There were some delayed physical milestones, as I think that's pretty common with kids with Noonan Syndrome, have a lot of delayed physical milestones. She was a really big sleeper. So from birth, she would sleep through all her feeds through the night, and then she would also have 2 daytime sleeps right up until she was 4. When she was in the high dependency unit and in NICU, they're on a very strict feeding time schedule, and I wasn't expressing enough milk, so they were formula feeding her, and they would ring me up and they would say, "We've tried everything, we've stripped her naked, we've put cold flannels on her, we can't get her to wake up for a feed, we're hoping, can you come in," because we weren't allowed to stay there, "can you come in and try and feed her?" And she's just always been that way, just a really big sleeper. She showed great intelligence from a very young age. She's always smiling, very happy, and she really didn't cry very much for anything other than her chronic pain in her legs. They caused her a fair bit of grief, but in general she was just a very happy, resilient, bright and bubbly little kid. She did always have coughs and colds, like snotty nose just constantly, and she did easily get sick. There's some more of her when she was little. So she was always smiling, always happy. You can see on the floor in the middle, that's a classic example of what Rowan was talking about before with the burnouts. She would quite often do that. You'd find her asleep just in the middle of in the floor, like in a very weird crawling position. She'd just crash out. There's some more of her. The medical appointments, we have a lot of these. From birth, she's had ongoing regular appointments. She's got low muscle tone and chronic limb pain. She had a lymphoscintigraphy done at 3 years to see if the swelling in her legs was actually lymphedema. Came out that it wasn't lymphedema, so they've just put it down to a mystery. They didn't really know what had caused it. She has had approximately 5 ear surgeries, from grommets, scrape and cleans, as well as canalplasty on her right ear, and her left ear canal is starting to collapse, so she needs to have canalplasty in 2022 for her left ear. She's had 4 MRIs and 2 CT scans for various reasons. A lot going on. These are just some of her medical appointments. She's a pretty tough little cookie. She's been through a lot. She was diagnosed with ADHD at 8, and she has a lot of sensory issues. She can't handle the cold weather at all. She can't handle even just walking through the Coles shopping centre because the Coles shops is too cold for her. She can't handle any kind of buzzing noises, insects, flies, anything, even butterflies she can't handle. She has a meltdown if there's anything buzzing around her. She doesn't like scratch pads or the sounds of any kind of scratching. She has a total meltdown. If an environment is too noisy for her, she can't concentrate. There's a lot of sensory issues. She has very hot showers, like she can't feel the heat on her skin. A lot of things going on there. She has says if she's a bent C2 vertebrae in her neck. So what we were told, she has basilar impression. So your C2 vertebrae is meant to be erect, straight up, and hers is bent forward at a 90-degree angle, and it's resting on, but not pressing on, her spinal cord. And there's a narrowing of the area between the spinal cord and the C2 vertebrae. So there's very little to no space for the spinal fluid to go between the bone and the spinal cord. So Sienna's very at risk of becoming quadriplegic if she gets a knock to the neck or the head. So her neurosurgeon has said no contact sports, nothing where she can, no downward pressure to the head, no roly-polies, nothing too physical. So we have to be very careful of that with her. And look out for any pins and needles in her arms and legs. So we have ongoing multiple specialist appointments. We see ENT, ophthalmology, dermatology, rheumatology, general medicine, peds, neurosurgery, dental, orthotics, physio, OT, cardiology, genetics, psychology, and we are just about to start urology and neurology. So we have a lot. And these are some photos, sorry about the blood. This is from her canalplasty on her right ear. Supposed to be a sort of fairly straightforward procedure, but as many of you know, kids with Noonan Syndrome or people with Noonan Syndrome have some blood clotting issues. So Sienna had some blood clotting issues when she had this, that they couldn't stop the bleeding. So she had to stay extra night and day in hospital until they could control the bleeding from her ear. But yeah, that's for anyone who doesn't know, that's they cut in behind your ear and then they drill into the skull until they get to the ear canal. They actually they cut into the ear canal and then they fill it with like a medical grade packing foam, basically to expand your ear canal, and that stays in there for about 6 weeks while the new skin forms over the foam to widen the canal, and then that foam stuff just dissolves and you have a wider canal. So it's quite a very invasive but worthwhile procedure to have. So rural living, this is my town. Our trees grow sideways. Dr. Derek didn't know that at the start. He thought I was joking. Yeah, so we live approximately 500 k's north of Perth. In Curtin, we have GPs and a locum paediatrician, but we don't have any specialists where we are. Many doctors don't know anything about Noonan Syndrome, so sometimes it's pointless talking to them because they just look at you with this blank stare and they're like, I have no idea what you're talking about. So we're always referred to Perth. And it's about 1,000k round trip every 1 to 2 months for us that we drive down. We fly if we can because Sienna has chronic pain in her legs, so driving can be painful for her. But we can't always fly because I'm a single mum, so I don't have someone there for my youngest daughter. So if I've got to bring my youngest daughter with me to the appointments, Pats won't cover her flights, and flights from Geraldton to Perth are very expensive, so it's cheaper for us to drive than to fly. But if I can manage to find someone to look after my youngest and Pats pays for our flights, it's a lot easier on us and a lot easier on Sienna. And that's it, Pats gives us some assistance to travel. Education. So I'll skip past this one, I can go forward. Sienna did win this Endeavour Award at school. We were very proud of her. She got this in year 4. And so the Endeavour Award is basically a strive your hardest, don't give up kind of award, hard work and achievement, which she really earned. So the first few years were tough with us. We had, even in before primary school, before kindy and that, we had daycare centres. We had to skip through, I think, 7 different daycare centres before we could find one that suited Sienna, that she felt comfortable with, that the daycare people felt comfortable dealing with her disorder, because she had such complex needs and a lot of the sensory issues, and at the time a lot of that undiagnosed autism. She couldn't communicate well and get along well and feel comfortable with a lot of people, so it was really difficult for us. We finally got there in the end. Until she was 8, she had undiagnosed ADHD, so she was quite a handful. Very high intelligence, she's a very smart girl. She has a high level of emotional distress, difficult making friends, and that's partly because of her facial features being slightly different, and kids are so brutally honest when they are 4 and 5 and 6. They just say things like, oh, your nose is big, or your face looks different, and they don't say it to be mean, it's just how they see the world. And it made it really hard for Sienna to make friends, and she didn't know a lot of boundaries. She's still getting there at 10, but knowing like the filter of saying something that's offensive, or touching someone when you shouldn't, like going up and giving them a cuddle when they don't want cuddles, or sitting too close to someone where you're like invading their space. Those sorts of boundaries she didn't know, and it impacted on her making friends at school. Yeah, she looked different to the other kids, and she had a lot of trouble adapting to new situations. She still does. And an example of that recently is that we had she has a nurse here at PCH that she got along really well with, very comfortable, great bond, and we hadn't seen her for a few weeks in all of our visits, and we asked her where she was, and Sienna got told that she'd moved hospital, she'd gone to a different hospital, and then we came down for our next visit, which was 1 to 2 months later, and it took that long for Sienna to get used to the fact that her favourite nurse is not going to be there anymore. Then she all of a sudden was, and she felt like someone had lied to her, and it was a complete meltdown. She was crying, and she was in like shock that people had lied to her, and the nurse didn't know what to say or what to do. It was just one of those things you had to, in the moment, deal with this change of situation that was a shock to her system. But she's like that with a lot of things. If you throw a new situation at her, it can be very overwhelming, and she has trouble dealing with it, and she quite often has meltdowns and sensory issues. Don't help with those. So this was her in kindy, very small and tiny, but happy, always happy. She was always happy. She got better teachers in primary school. So what I mean by that was in kindergarten and pre-primary, she was not diagnosed with ADHD or autism, and she was just looked at as a naughty kid, a problem child, and constantly sent to time out, constantly sent to the office, constant phone calls to mum, just constant. She was on a behaviour plan at 4 years old because they didn't know how to deal with her. But when we got the diagnosis of the ADHD and there was a suspected autism, things started to get a bit better, and in primary school she had better teachers, there were better programs, so it got better for her as she went along, and she started to get a bit more determination, thinking, I'm not just naughty, it's not just me, there's actually reasons why she is the way she is, and she does things for a certain reason. She won the school spelling bee in year 1, so it was a great achievement for her. And she's still in the top literacy group in years 1 to 4. She's always been in the top literacy group. Right now she's in year 4, and she's currently doing spelling with year 6 students, so in the top spelling groups at school. So she's very smart. She won the Class Endeavour Award, which you saw, and she's in year 4 now, working at a year 5 level, doing some year 6 spelling. And this was her in primary school. This is just before we changed her school, so this is when she won the Endeavour Award. So we're very proud of her. Her diet. So she's very thin, she's very small, she's the smallest in her class. You can see, it's very easy to see her ribs. She's got a very small appetite. She doesn't eat a lot at all. Partly to do with the ADHD medication, but even prior to that, she's not a big eater. She'll rarely eat a full meal. She's small in height and weight, and she's not on growth hormone yet. Although she's small and she's thin, she's not below. She's sort of going along quite okay. She's sort of not below the line, but she's going along okay. Dental. She has some severe dental problems. Sienna's got, for starters, she's got very poor quality teeth. Her teeth actually don't have very good enamel on them, and I don't know what you call it, like they don't root in, all the roots like eat away in her teeth, so they don't stay in her teeth, in her jaw very well. So she's actually currently got 6 stainless steel caps on her teeth. They tried the plastic ones, but because her teeth are such poor quality, the plastic ones wouldn't stick. They fell off after like 2 months, so they've gone and put stainless steel ones on now. But she also has, her bottom jaw grows at a quicker rate than her top jaw. So that's the severe structural problems, and she needs extensive orthodontic work that's going to be going on, and it causes her speech problems. So on the far picture on that side, I'm not sure if you can see, I tried to get a side-on shot, so you can see that her bottom jaw protrudes out further than her top. So the orthodontics team have said that she will, when she's in a couple of years' time, 2 or 3 years' time, she's probably going to need surgery to remove part of her bottom jaw, and they're going to actually put a screw in the roof of her mouth that they have to turn to actually widen and expand the top jaw. So it's quite an expensive lot, and she needs a plate and braces because she also has Class 3 malocclusion, which is a really bad open bite. So not only does she have that happening with her teeth, she also has the teeth falling out. So when she actually bites down with her back jaw, she can stick her whole tongue back and forth through the gap in her front teeth when her back jaw is closed. So it causes speech problems and eating problems when she's talking. She has the ptosis on her eyes, so the droopy eyelids. I didn't have that many photos at the time when I was putting these up. The first one is probably the best. You can see her left eye is actually worse than her right. So we just constantly measure that when we see ophthalmology. They just put a ruler up and see how much it's dropped over the time. But she also has a little bit of I can't remember what it was called, with the fold on the inside of your eyes. She's got a bit of that as well, and she's got the widely spaced eyes. Sensory issues. So Sienna's definitely got a lot of sensory processing, anxiety, ADHD. She's got the works happening there. So she goes through a lot of these. Easily frustrated, irritable, definitely prefers to be alone. She quite often just plays alone in the playground. Physical complaints have been since day dot for her. Very much becomes easily distracted, short attention span, struggles to complete tasks if there's too much going on around her. She has meltdowns set off by any of those particular things: crowds, unfamiliar settings, physical touch, the weather, sounds, insects, pretty much anything. Her chronic leg pain. She suffers chronic leg pain about 3 nights a week and has done since she was a baby. Her pain is immobilising for her. She becomes unable to walk. She just cries. She just sits down in the middle of the floor. It doesn't matter if it's a shopping centre, home, someone's house. She'll just sit where she is and cry and grab her legs. She can't bear weight on them at all. With all the other things going on, it's extremely difficult to communicate with her when she's got sore legs. It's very difficult to get her to cooperate, like get up off the middle of the shopping centre floor. We can't do this right here. You need to move. Sometimes it's really difficult. Quite often massage is the only thing that I can do to help. I give her the pain relief, but even that takes like 15 minutes to kick in, and during that 15 minutes it's torture, so I've got a massage to help relieve the pain. And she is on clonidine, which helps relax her muscles at night time, so that helps a lot. If we forget to give her clonidine at night time, we're just pretty much guaranteed leg pain through the night. It's tough. Being a parent of a child with Noonan syndrome is a long and arduous role, but it's worth every second. The rewards you get from having a special needs child well and truly outweigh the ongoing hard work and tough times. Sienna is the most beautiful soul. She is so amazing. She's strong, determined, intelligent, loving, compassionate and brave. I am so proud to be her mum. And there she is. It's worth it. And that's my story. So thank you very much for listening to me. Oh, thank you.